The difference between a smooth surgery with quick recovery and a nightmare with complications often comes down to what you do before you ever enter the operating room. And most patients skip critical steps that could save their life. Number 1. They get a second opinion on whether surgery is actually necessary. Not all recommended surgeries are truly needed. Some conditions improve with conservative treatment. Some surgeons are more aggressive than others. Smart patients ask, is this surgery urgent, or can I try other options first? What happens if I don't have surgery? What are the alternatives? Here's what most people don't do. They accept the first surgeon's recommendation without question. But studies show that second opinions result in changed treatment plans in 10 to 30% of cases. Sometimes surgery isn't needed at all. Sometimes a different surgical approach is better. Getting a second opinion isn't questioning your doctor's competence. It's being a smart consumer of healthcare. For major surgeries especially, always get a second opinion. Number 2. They research their surgeon's experience and outcomes. Not all surgeons are equally skilled. Experience matters enormously. A surgeon who's done a procedure 500 times has better outcomes than one who's done it 50 times. Smart patients ask, how many times have you performed this specific surgery? What's your complication rate? What's your infection rate? Can I see your outcome data? Here's the reality. Some surgeons get offended by these questions, but good surgeons welcome them because they're proud of their results. If a surgeon refuses to answer or gets defensive, that's a red flag. You can also check state medical boards for malpractice history and disciplinary actions. Choosing the right surgeon is one of the most important decisions you'll make. Number 3. They optimize their health before surgery. Surgery is trauma to your body. The healthier you are going in, the better you'll handle it. Smart patients quit smoking at least 4 weeks before surgery. Smoking impairs wound healing and increases infection risk. They control their diabetes. High blood sugar increases infection rates dramatically. They lose weight if obese. Obesity increases surgical complications. They improve nutrition and take recommended supplements. Here's what people ignore. Your pre-surgery health status determines your recovery. If you're malnourished, anemic, or have uncontrolled chronic diseases, your complication risk skyrockets. Work with your doctors to optimize everything possible before surgery. Sometimes delaying surgery to improve your health first leads to better outcomes than rushing into surgery in poor condition. If you're learning what separates smart patients from everyone else, hit subscribe. We're giving you surgical prep knowledge that most people only learn after complications happen. Number 4. They bring an advocate to all pre-surgery appointments. Smart patients never go to important medical appointments alone. They bring a family member or friend who takes notes, asks questions they forget to ask, and remembers information they're too stressed to retain. During pre-surgery consultations, you're anxious and overwhelmed. You'll forget half of what's said. Here's what the advocate does. They write down medication instructions, ask about recovery timeline, clarify post-op restrictions, and make sure all questions are answered. They can also advocate for you if something seems wrong when you're too vulnerable to speak up. Having a second set of ears and eyes is invaluable. Number 5. They complete all pre-surgery testing and clearances early. Smart patients don't wait until the last minute. If you need cardiac clearance, pulmonary function tests, lab work, or imaging, schedule it immediately. Labs can reveal anemia, infections, or other issues that need addressing before surgery. Cardiac testing might show problems requiring treatment first. Here's what happens when you delay. Testing reveals a problem the day before surgery. Now surgery is canceled or postponed while the problem is addressed. You've taken time off work, arranged childcare, and mentally prepared for nothing. Smart patients get testing done weeks in advance so problems can be addressed without derailing surgery. Number 6. They ask exactly what will happen and what could go wrong. Smart patients understand the procedure, the risks, and the recovery. They ask, what exactly will you do during surgery? What are the most common complications? What are the rare but serious complications? What's the worst-case scenario? How will I feel afterward? What limitations will I have? Here's why this matters. Informed consent forms list every possible complication, but surgeons often downplay risks. Smart patients push for realistic expectations. If there's a 5% chance of nerve damage causing permanent numbness, they want to know. If recovery typically takes 6 weeks, not 2 weeks, they need to plan accordingly. Understanding realistic outcomes prevents post-surgery shock and disappointment. Number 7. They create a detailed medication list, including supplements and over-the-counter drugs. This is the one most people forget, and it's dangerous. Smart patients list every prescription, every supplement, every vitamin, every herbal remedy, every over-the-counter medication they take. They bring the actual bottles or a typed list to appointments. Here's why this is critical. Some medications and supplements increase bleeding risk: aspirin, ibuprofen, fish oil, vitamin E, ginkgo biloba. Some interact with anesthesia. Some affect blood sugar or blood pressure during surgery. Your surgeon needs to know everything you're taking to tell you what to stop and when. People forget to mention harmless supplements or occasional medications, then have complications during surgery because of drug interactions. Don't assume anything is too minor to mention. Number 8. They arrange their home and support system for recovery before surgery. Smart patients don't wait until after surgery to figure out logistics. They arrange time off work, childcare, pet care, and help at home. They prepare their home, move frequently used items to easily accessible locations, set up a recovery area on the main floor if stairs are difficult, stock up on easy-to-prepare foods, fill prescriptions in advance. Here's what people underestimate: post-surgery limitations. You might not be able to drive for weeks. You might not be able to lift anything. You might need help bathing and dressing. Smart patients arrange help before surgery so they can focus on recovery rather than logistics while in pain. If these tips are showing you what you've been missing, make sure you're subscribed. We're revealing preparation steps that separate successful surgeries from complicated ones. Number 9. They understand and follow pre-surgery fasting instructions precisely. Smart patients know exactly when to stop eating and drinking before surgery and follow those instructions to the minute. Eating or drinking too close to surgery can cause aspiration, stomach contents entering your lungs during anesthesia, which can be fatal. Here's what people mess up. They think a sip of water won't matter. They chew gum. They take morning medications with water when they weren't supposed to. Then surgery gets canceled. Or worse, they aspirate during anesthesia. Follow NPO, nothing by mouth, instructions exactly. If you're supposed to take certain medications with a small sip of water, confirm exactly which medications and how much water. Precision matters. Number 10. They plan for realistic recovery time and limitations. Smart patients ask detailed questions about recovery. When can I return to work? When can I drive? When can I lift things? When can I exercise? When can I shower? They plan conservatively, assuming recovery will take longer than the best-case scenario. Here's what people do wrong. They plan to return to work in 1 week when realistic recovery is 3 weeks. They schedule important events right after surgery. They don't arrange adequate help. Then they're forced to do too much too soon, risking complications. Smart patients plan for worst-case recovery timelines and are pleasantly surprised if they recover faster. Number 11. They confirm everything the day before surgery. Smart patients call the hospital the day before to confirm surgery time, arrival time, and any last-minute instructions. They verify who's driving them and picking them up. They pack a bag with essentials: phone charger, glasses, comfortable loose clothing, list of medications, insurance cards, and copies of advance directives. Here's why this matters. Sometimes surgery times change. Sometimes you were supposed to arrive earlier than you thought. Confirming everything prevents day of surgery chaos. Smart patients also confirm they followed all pre-surgery instructions correctly, stopped the right medications, fasted properly, completed pre-surgery showering with special soap if required. Bonus tip: they ask about enhanced recovery protocols. Smart patients ask if the hospital uses enhanced recovery after surgery (ERAS) protocols, evidence-based approaches that reduce complications, shorten hospital stays, and improve outcomes. ERAS includes things like avoiding prolonged fasting, optimizing pain control with minimal opioids, early feeding, and early mobilization. Not all hospitals use these protocols, but they dramatically improve surgical outcomes. These 11 things separate patients who sail through surgery with minimal complications from those who suffer preventable problems. Most people treat surgery passively. They show up and hope for the best. Smart patients actively prepare, ask questions, optimize their health, arrange support, and plan realistically. Surgery is risky enough without adding preventable complications from poor preparation. The time you invest before surgery preparing properly determines whether your surgical experience is a success story or a cautionary tale.